ABCDE assessment, breathing. After assessing the patient's airways, you need to assess their breathing. The vital signs you will need to record as part of your breathing assessment are the oxygen saturation of the patient, the count per minute of respirations, and whether they are on air or oxygen. You are looking at the rate, rhythm, and depth of the patient's respirations to understand how well they are breathing. Remember the look, listen, feel approach. Look for visual clues, such as whether their mouth is open or closed, if they are arching their back to try and inhale more oxygen, and any evidence of accessory muscle use. Listen for any sounds of respiratory distress, such as rasping or breathlessness. Feel for equal chest expansion or any chest deformities. It can be easiest to assess the patient's lung expansion by asking them to sit forward and placing a hand on each side of their upper back to see if they are symmetrical. Asymmetrical lung expansion can indicate respiratory distress.
Okay, Mona, at this time, I may need you to sit forward. Would you be able to do that if I lend you a hand?
Yeah.
Okay. All right. Okay. So I'm going to check your back for your chest expansion. All right.
I am going to use the surface of my fingers and hands to feel for abnormalities. I am assessing for chest movement symmetry, chest skeletal abnormalities, tenderness, skin temperature, swelling, and masses. I will stand behind Mona and place my hands with fingers spread apart beneath her arms. On the side of the chest, about 2 inches below the axilla. My fingers will be pointing towards the anterior chest. This will let me feel the chest wall rising and falling on inspiration and expiration. I will ask Mona to take deep breath in and exhale out completely. I will be looking at my hands and thumbs to see that they have moved equally on both sides. The patient's chest will be auscultated in all 3 areas: apices, mid-zone, and bases, and compared left to right.
If your patient is unable to sit themselves forward, it would be appropriate to ask for help with supporting the patient to do this. The patient's respiratory rate is a key element of the breathing assessment. However, it is not advisable to tell the patient that you're going to count their respirations, as it may artificially change the rhythm of their breathing. To do this more discreetly, we recommend that you count the patient's respirations while the oxygen saturation probe is on their finger. Ask the patient to be calm and quiet for a minute or so whilst the probe is on their finger to enable them to do this. A patient's oxygen saturation shows how much oxygen is in the blood and can indicate how easy or difficult a patient is finding it to breathe. When taking a patient's oxygen saturations, you must start by telling them what you are about to do in order to gain their consent.
So I'm going to get your oxygen saturations. And able to do that, we will need a pulse oximeter clip on your index finger. Would this finger do?
Yeah.
But before doing that, I may need to assess it for any fake nails, varnishes, or signs of cyanosis.
I note that the finger is free from nail varnishes, fake nails, and it's warm to touch but not clammy.
Okay, Mona, I'm clipping the pulse oximeter on your finger now. I want you to stay relaxed, and this may take a minute or so.
Oximeter should provide you with a percentage reading of blood oxygen level. In most patients, a score of over 98% is normal. However, those patients with chronic respiratory problems such as COPD would have a normal score of between 88 to 92%. It is important to verbalize checks for nail varnish or false nails because these accessories could prevent you from gaining an accurate reading of the blood oxygen level. These may need to be removed if you believe they are preventing you from getting an accurate reading. Also, check that the finger is free from any infection or inflammation and the finger is warm rather than cold or clammy. On the News 2 chart, there are two scales for recording oxygen saturation: Scale 1 and Scale 2. It is not up to you to decide which chart should be used. The front of the News 2 chart and/or the station scenario should tell you which scale is in use. However, in the OSCE, it would be very unusual for Scale 2 to be used. We recommend leaving the SpO2 scale blank at this point, rather than putting a line through it. This is because the patient may not have a diagnosis yet, and it is possible the SpO2 scale may be used later in the assessment process. In this scenario, the oxygen saturation level is normal, so we will write the score in the white box in Scale 1. Don't forget to advise your patient of the result.
Okay, Mona, I already got your oxygen saturations. It's at 97%, which is normal.
Whilst the oxygen saturation probe is on your patient's finger, we recommend you assess the patient's respiration rate. To count patient respirations, you should look at the patient's chest to note how many times their chest rises and falls. Use a clock to help you count. Each breath in and breath out is one cycle. You need to count how many respiration cycles the patient has in 1 minute. If the patient's chest rises and falls 13 times in 1 minute, 13 respirations per minute is the correct respiration rate. After completing the respiration rate measurements, you must tell the patient their scores and indicate to them whether or not it is the normal range.
Be comfortable, alright? So the time is 5 minutes past 7, and I'm commencing my observation. I didn't tell you, but I also counted your respirations. The result is at 30 cycles per minute, which is a bit high, and the normal range is at 12 to 20, right? So this means we might need to monitor you more closely. Okay?
Okay.
You should document your findings immediately after completing them. Look at whether or not they fall into the acceptable range. If, as part of your observations, you notice that the patient has irregular breathing, you should offer to reposition them to make their breathing easier. You may also want to make a note of this so that you can address this in your care plan at the next station. We also need to add to our patient record whether or not the patient is on air or oxygen. Put an A in the box if they are on air. If they are on oxygen, they will get an automatic score of 2. In order to populate this box accurately, you need to check their oxygen flow rate. This would usually be indicated on the OSCE scenario paperwork. There may also be an oxygen gauge you can read in the scenario to understand the oxygen flow rate.
Now, I can't see if it's on right now. So, examiner, can you confirm that the patient has 4 liters of oxygen therapy?
Yes, I can confirm that the patient is on 4 liters of oxygen per minute.
I am just going to mark on your chart that you're receiving oxygen therapy via simple face mask, which is a score of 2 in the News 2 chart.
No, that's it.
You will need to state the oxygen device the patient is on. In the OSCE, they are most likely to be wearing a non-rebreather mask, so you would write NRB in the device box. Other types of masks include a nasal cannula mask, NC, simple mask, SM, or a Venturi mask, VM. you should try to familiarise yourself with the different types of mask in the UK prior to the OSCE. So, for example, if the patient was on 4 litres of oxygen per minute via a non-rebreather mask, you would record this as shown. Familiarise yourself with the different types of mask available using our mask infographic. Poor breathing could be caused by muscle weakness, trauma, spinal damage, pain-reduced respiratory drive, or a lung disorder. Treatment could include high-flow oxygen by a non-rebreather mask, suctioning, or ventilation.